Hello, everyone. This is Brian Devine from Topline, and today I have with me Dr. Dongieux, who practices in New Orleans, Louisiana, and we are going to be talking about orthodontics and Invisalign and why he uses it in Eli Orthodontics, his practice. So, welcome, Dr. Dongieux.
Hey, thanks for calling me, man. I'm excited about doing this.
Absolutely. I'm glad to have you. You know, let's start with having you tell us a little bit about yourself so people can get to know you a little bit.
Okay, well, I've been practicing orthodontics for 50 years. I've done over 20,000 cases. I practice now 6 afternoons a month, and I do Invisalign, I do regular braces, ceramic braces, bleaching, anything to really have someone have a wonderful smile.
Excellent. Now, I know that Eli Orthodontics, the name of your practice, stands for something a little unique. What is that all about?
Eli means everything looks incredible. It's a name that really talks a little bit about what we're up to. You know, we want a lifetime satisfied patient that is very happy with their result and will. And over the years have been the people that have referred their friends and families to us over the years.
Very good. Wonderful. Now, if I'm watching this today and I am in the process of trying to figure out how to find a good orthodontist, what would you say that I should be looking for?
I think you should find an orthodontist that will, first off, would not charge you for the initial visit and would take a free panoramic x-ray so that he could actually see what's wrong, if it could be fixed, how long it took, how much money it cost, and it's actually paid. And the panoramic x-ray is one that can be used by the dentist to determine whether or not the orthodontist wants certain baby teeth removed or certain work done before the actual braces are applied. And so the patient likes to, and parent likes to actually trust the orthodontist, and the orthodontist actually gives the impression that he's really going to take care of their child because they don't know a lot about dentistry or orthodontics when they come.
All right, so it's important when you're choosing an orthodontist that you get some time with the orthodontist, that you know that they're actually looking at something of value like a panoramic x-ray in order to help guide you along that process.
Sure. Mm-hmm.
Excellent. Now, you mentioned Invisalign. Tell me about Invisalign in your practice.
Invisalign is, first off, there was a time when I used to do braces on the back of the teeth called lingual braces, and it's not that easy or not that inexpensive to do that upside down and backwards.
Mm-hmm.
So Invisalign came along, and Invisalign is a series of clear, plastic, removable slip covers that go on the teeth that the patient wears. The patient wears them except while they eat and brush, and they change to a new set of aligners every 2 weeks. And it actually moves the teeth to a perfect position on almost all kinds of orthodontic problems. It's done on teenagers and adults, and we can't use it on young children that have a mouthful of baby teeth.
Okay. Now speaking of a mouthful of baby teeth, you know, we're hearing a lot about early treatment, early intervention these days, and I think there's a little bit of misinformation about it. What is the point in your practice for seeing somebody before they've lost all of their baby teeth?
Well, there's a perception out there in dentistry that patients should go to the orthodontist when they've lost all their baby teeth. Well, if you wait until then, certainly the case is more complicated. Child might end up wearing braces when they're in high school and then even going into college. And what really needs to happen is if you have a child with a problem with their skeleton, in other words, the upper jaw is too long or the lower jaw is too long or if they don't fit together right, then you need to see children as early as 6. But usually the best time to see an orthodontist if they don't have a skeletal problem is around age 9, where the eruption can be guided by the orthodontist, and the dentist can remove teeth or fix teeth or do whatever to either minimize the orthodontic treatment or maybe even to avoid orthodontic correction.
Fantastic. I think that's what people really kind of needed to understand, is that it's more than just getting someone in early. It's about what you can do to help make the treatment easier and possibly even more effective for the child.
Absolutely.
Now, wonderful. Now, we talked about, you mentioned free exams and x-rays in your office, and I want to give somebody an idea of what to expect. If they were to call your office, what can they kind of expect from that first call?
Well, what I want them not to expect is to think that they're talking to a machine.
Okay.
What I want them not to hear is, well, we have a 2 o'clock and an 8 o'clock, and we have a Friday and a Monday, and so forth and so on. They want to get from the conversation, the very initial conversation, the idea that this is the orthodontist that I want to go to. That's caused by the reception person that takes the call actually creating a relationship with the person that's calling in and asking them a question and or telling them that we do treat the particular problem that they're coming for. And by creating that relationship, what happens is the new patient actually makes the appointment and comes on time because they feel like they're a fit from the very first phone conversation.
Wonderful. So for those of you that have been watching so far, if you're still with us, take advantage of the free exam, and now you kind of can expect a little bit different conversation on that first call. So give them a call. It's 504-835-CARE. That's 504-835-2273. Give Dr. Dongieux a call. Find out, feel free to ask questions. I mean, I think that's what sets them apart, especially on that first phone call. It's not just about getting you in. It's about learning about you, your needs, maybe it's your child's needs and what's going on, so that you know what to expect when you come in for that free exam and x-ray. Dr. Dongieux, thank you so much for taking some time to talk with us today. I really do appreciate it, and I think everyone else that's managed to catch us here does as well.
Thank you so much.
Absolutely. Okay, everybody, bye for now.